What is total femur replacement? It's a surgery in which total femur is replaced by a total femur megaprosthesis, which is an artificial implant. The thigh bone or femur bone forms hip joint with the acetabulum and knee joint with the tibia bone. This is a case where tumor was affecting the thigh bone or a femur bone, and a radiograph showing osteosarcoma of left femur, which was treated with neoadjuvant chemotherapy. During surgery, the femur bone was removed and resected, and this is the defect which is created following the resection or removal of the tumor. This defect is replaced by a artificial prosthesis, that is total femur megaprosthesis, and we are replacing the hip joint, knee joint and the thigh bone with a artificial implant. This is a radiograph showing the surgical steps of total femur megaprosthesis. And to summarize, it's a case of osteosarcoma femur which was treated with total femur megaprosthesis implant. Following this, we will be seeing what is the functional outcome of the patient following this complex hip, knee and thigh bone replacement surgery. So in this case, the greater trochanter and abductors were attached to the implant. We can see here the heel scar following surgery, and the patient is able to stand, bearing complete weight on her legs. The patient can do abduction and adduction at hip joint. The patient is able to stand on one leg and here we can see the knee flexion and extension, and this is the surgical heel scar. Patient had limitation of knee flexion movement. This is the knee flexion and extension at 4 years follow-up after the surgery. Patient is having complete ankle flexion, dorsiflexion and extension as all the nerves were intact. Sciatic nerve was preserved. And this is the walking video of the patient, and patient is able to walk without any support. There is limp and slight lurch during the walking because muscles around the hip joint were resected. This was the patient's hip abduction and adduction, and patient is able to do good amount of abduction adduction movement despite replacement of the total femur, because the greater trochanter and hip abductors were attached to the implant. So the patient can be able to walk completely without support following this major hip joint, knee joint and thigh bone resection and replacement surgery. Thank you.